Good evening, all. As you all know, today is the sixth and final day of the webinar series talks on transgender and sexual minorities health awareness. So we do know that the transgender people have to go through multiple hurdles before they complete their transition to their self-identified gender, as we call it. So for that, first they have to like psychologically accept themselves for who they are, and also make the society understand the real person or their own real identity. And for that, the physical transformation is also very important. That is where today's topic is comes into highlight, as we are going to tackle the skin related issues or transgender skincare. Because for a transgender person, when they're physically transforming, it is not just surgical complications that they have to go through. There are a lot of skin and hair related problems also they will definitely face. So there are a lot of effects and side effects when a trans man or a woman actually takes hormones and goes through these multiple steps, which allows them to be the final person that they want to be. So today, our expert speaker, Dr. Pranaya Bagde, who is actually a psychodermatologist and also a leading hair transplant surgeon, will be taking us deep into the details regarding the skin and hair related issues of transgender people. We welcome you, madam, to this program. And let me also share with you a small introduction about our speaker. Dr. Pranaya Bagde is a dermatologist by profession. She has done her MD, DNB in dermatology and MSc in psychology. She is one of the leading psychodermatologists and hair transplant surgeons. She is a national and international faculty in the subject. She is also founder of Inside Derma Clinic in Kochi and vice president for Pride in Practice Society. She has a functional approach in treatment of skin ailments, which makes it a more holistic and harmonious practice. So with these few words, let me welcome you once again to this program, madam, and let me conclude my welcome address. Thank you for joining. Over to you, madam.
Thank you. Thank you for having me here and giving an opportunity for Pride in Practice Society to participate in this platform to have awareness on transgender health. So I would like to go ahead with my presentation now. So transgender skincare, a guide for addressing dermatological issues in transgender people. I just made a little change here. It was trans patient, but I made it transgender people because now when it comes to cosmetology and other practices, not necessary that they are patients. So going ahead with my presentation, and I'll be covering the topics like general dermatological issues in transgender population, cosmetological and aesthetic needs during transition and otherwise, hair transplantation and dermatosurgical procedures they need, venereological issues in transgender people, and at last, psychodermatological issues they face. So coming to the basic question, is skincare important for transgender population? And yes, the answer is obvious because it is the most sought medical care by trans people. And why? Because skin is the organ of expression and visibility. But unfortunately, we do not have guidelines for skin health in transgender. WPATH and IPATH do not mention any such guidelines. When we deal with LGBTIQPA community, what all things basically a practitioner should have? First thing is the communication. That actually makes us have the rapport with the trans person. And when we are addressing them, when we are greeting them, or when we are asking questions, how we should do that? That is a basic part of communication that from a doctor goes to the trans person and they feel, am I welcome? Am I being greeted or am I being accepted? Then the very crucial point, how to address them. Usually in Kerala, we address them Chechi, Chetan, Amma, Acha, or we can call sir and ma'am. But here there is an exception. Instead of addressing them sir, ma'am by their biological appearance, we should ask them, how would you like me to address you? There you can understand what is their identity. And when you ask that question, definitely they become little close to you to understand that you are accepting them. Family addressing again. When we are dealing with venereological issue, the history of the partner is very important. So when I have to ask something about the partner, I have to respect the privacy. And at the same time, we should not use the words like husband or wife. It is the spouse or partner. That is how you should communicate. These are very small little things that make a difference, that how you interact with the person. Next, very important is taking care of their psyche. That's a mental health perspective. We already had a elaborative session on that, but here, being the first contact for their skincare, having note of their mental health is very important. So when they come to a dermatologist for any skin condition or any problem or any cosmetic procedure they want, we have to identify whether they have any stressors, and we have to give supportive care to them. They might have certain beliefs related to their appearance or related to their community. It must be a lot of grief also. So we have to respect that and be a patient listener at that time. And obviously, above all, we have to avoid discrimination. When all these basic things are being created and a good rapport is formed, then only the trans person can be given any skincare effectively and positively. So that at the receptive end also, they are welcoming that what are options we are offering or what all treatment they need to go through, they can be comfortable with. Then coming to the disease management or diagnosis. Here we have to identify what is a cause, what is trigger, and what is a health risk, particularly in trans community. And we also have to involve them in decision making for any treatment options that we choose. Again, very importantly, the caregiver has to understand the legal rights of the person who is coming to us, their spiritual or religious belief. So these are the basic things that any practitioner should have when they are dealing with a trans community person or any LGBTIQA person. So what are general dermatological issues that a transgender faces? Basically, when they identify their gender and they say, okay, I'm a trans man or a trans woman, definitely they want to undergo certain transformation. In that process, they go for hormonal replacement therapy, sometimes puberty suppression. It starts from pediatric age, right? So sometimes puberty suppression. If it is in the adult age, hormonal replacement therapy, then gender affirming procedure. And then in cosmetology, basically gender transitioning interventions are done. So these three things are very vital in their life when they are changing their gender or transforming into another desired gender. So many of the skin issues that happen in transgender community, they are mainly related to these treatment options that they go through. What it brings? It brings certain changes in the prevalence of some skin condition, changes in their presentation, which we usually see in cisgender population. Maybe there will be little modification or change in their presentation. So this is what very crucial to understand, that we should also have guidelines pertaining to this, that any change in the skin happening when a trans person is going through this procedure of transformation, that has to be noted and cared for. So the very common skin condition a transgender person goes through is acne. Why so? Acne again has multifactorial origin. Usually at the onset of puberty, because of the hormonal surge, acne starts coming. That usually happens in cisgenders also. Why it is important in trans population? Because they are taking hormonal therapy. So a trans man who is on testosterone therapy, testosterone will be more in their body, which is actually, it takes 1 to 2 years for their body to normalize and get back to the desired state. But when initially testosterone therapy started, lot of acne eruptions happen abruptly. A person will come in the age group of 20 to 30 and he will say that I'm a trans man and I want to transform. I have started my testosterone treatment. Before I never had any acne or any pimples or oily skin, but now I have started it. So that is a very important history to note. Sometimes those who had a history of acne, their acne will become suddenly more severe when they are on the testosterone therapy. So here, all the grades of acne can be there from mild to severe, depending upon that individual person. And here, there is no much variation in the treatment. We have to grade the acne as it is mentioned in this picture. We have to grade the acne from grade 1 to grade 4. And depending upon that, you can give oral antibiotics, oral retinoids, or topical medication. And then certain cosmetic treatments are also available, like chemical peels can be done, comedone extraction can be done, certain laser treatment can be done. So this is the plan we can make according to the severity of the acne. But sometimes when there is a lot of hormonal changes that are happening in the body or higher doses of testosterone are given, we see severe acne, nodulocystic or abscess formation also. So we have to take care of that accordingly. Next very common condition, general dermatological condition we see is pigmentation. So hyperpigmentation, especially on the face and flexural areas, is very common in trans population. Why so? Usually we get pigmentation on exposure to sunlight. We call it phototanning or freckles or lentigens. Other than that also they get this pigmentations, that is what we label as melasma. Usually melasma we see in cisgender women. Now it is not uncommon in men also, which is mainly on the butterfly area of the face. From the nose, it goes onto your cheek. It may involve the upper lip, forehead, and now sometimes it can go on the neck also. Similar type of presentation happens in trans women. Why so? There is a hormonal replacement therapy. So the estrogen that is being taken, that actually causing this hyperpigmentation. So this is also very common problem that they come to us with. Here again, the flexural hyperpigmentation is very typical in them. So they come with pigmentation on the neck area, axillary folds, groin areas also. How to treat it? Again, as we treat it in the normal population, we can offer them options of topical treatment, topical medications to apply. Sun protection is very, very mandatory. Every day, even on a cloudy day, they have to protect their skin, moisturize it properly. And obviously, for cosmetic concerns, the pigmentation removal treatment can be done in the form of chemical peeling or laser treatment. So this goes as a ladder or this goes as an adjuvant treatment. And it is the same as we do in the general population. Next very common general condition is hair related issue. So in trans population, when they are in the transition phase, both the things can happen, that there will be unwanted hair growth and there will be unwanted hair loss also. So in trans women especially, they develop this unwanted facial hair growth, even though they are on estrogen and anti-androgen therapy. So that is one concern in them, that they come to us for removal of those hairs. Next, in trans men. In trans men, because in transition phase, they are put on testosterone treatment. So their androgen receptor activity goes high and they're prone for pattern baldness or androgenetic alopecia. Androgenetic alopecia is again a genetic condition. So a person, because a trans man is a female, born as a female. So if there is a genetic preponderance in them, then again, there is a chance of androgen receptor activity and hair fall. But when they are started on testosterone treatment, the pattern baldness is more prevalent. This is how it looks. So what is hirsutism and what is hypertrichosis? Hirsutism, we usually say that it is a male patterned hair growth in a female in unwanted areas, while hypertrichosis is just abnormal hair growth. So this is the difference. Usually in a cisgender female, when we say hirsutism, must be the male hormones are high in them. That is why they develop the male pattern hair growth. But hypertrichosis need not be related to hormone level always. So in trans men, what happens that they are taking testosterone. That is one reason that the androgen receptor areas like scalp, beard, mustache, these hairs have androgen receptor activity, and under influence of that, it grows. The same time, when trans woman wants to convert and they are on estrogen treatment, but still what happens that the androgen activity has to be suppressed to the level that the androgen receptor on that particular area should get reduced and hair growth should come down. So in transition phase, both these things will happen, that trans men and trans women both will come with some of the overlapping features of hair growth. The one was androgenetic alopecia again. So this is the picture of a trans woman who is having early baldness. So this also happens, and they come to us saying that they want hair transplantation in that area. Here they are on estrogen and female hormone therapy, but still the androgen receptor activity is there. That is the reason that they get the baldness, and hair transplant is a very sought treatment for them. Next common condition is skin issues like dry skin and oily skin. We all have different type of skin. We have normal skin, dry skin, oily skin, combination skin, sensitive skin. So what happens in transgender population, particularly when they are put on hormonal therapy, there is sudden change in the sebaceous glandular secretion onto the skin. There is a sudden change in the sweat gland secretions onto the skin, and above all, the receptor activity also changes. So sometimes the skin texture becomes oily or dry. So both the things can happen in a trans population under the transition phase. So the tendency for the dry skin is equal to the cis population. So there is not much variation, but the oily skin is more prevalent in trans population. So the oily skin is mainly seen on the T-zone of the face or the all over the face, sometimes on the trunk, groin, axilla, all these areas, they will have greasy, oily skin texture. And it also manifests with pimples on the body, like hairy areas on the chest or trunk or buttocks or groin area, they get big pimples. Pus formation, folliculitis and pustules. Sometimes only red papules on those areas. Sometimes they have a lot of scaling and flakes on the surface of the skin, indicating either dry skin or even flaky seborrhea and folliculitis. So there are different manifestations that can happen as a part of oily skin and dry skin in trans population. And it is basically when the hormonal change is happening, there is, as I mentioned, the changes are happening into the skin, in the oil gland, the sweat gland. So that is why this manifestation is happening. Then we have seborrheic dermatitis, which is also very prevalent in trans population. So I was just mentioning seborrhea means increased sebum secretion onto the skin. So this is again because the sebum secretion is under influence of the hormone. So any change in the hormone can give rise to alteration in the sebum secretion. So this is very common in trans men and trans women both, especially those on hormonal replacement therapy. And there are different forms of seborrheic dermatitis. And when I say seborrheic dermatitis, dandruff is a layman term which we call as scalp seborrhea. So how it presents on the scalp, sometimes it will have scaling only. So just scaly localized patches. Sometimes it could be diffuse scaling. Sometimes greasy yellowish scales will be there and it will be itchy. Sometimes nothing of it, but only powdery flakes. Some people also associate it with hair fall. So this is about scalp seborrheic dermatitis. But when it is dermatitis which is extending beyond scalp, it can also happen on eyebrows, eyelashes, perinasal area, even periauricular area. So these areas will also have greasy yellowish scale, sometimes flaking and itching. So when scalp seborrhea is there, we also have to see whether other areas of the bodies are also involved, because this is also not uncommon in trans people to have body involvement as a part of seborrheic dermatitis. Next, very common sought treatment is cosmetology procedure. We know because skin is a visible organ, how you look, how good you are looking, that matters a lot. And when it is a trans population, their appearance is their treasure. So they always want to look the way they desire in their mind. So here, it's very critical for a dermatologist to understand their need, to understand the realistic expectation that they have, and also to understand what treatment are suitable for them and how they will tolerate it. So first, very common query that comes to us is unwanted hair removal. And the maximum percentage of population, trans population that comes to a dermatologist is basically for hair removal on certain body areas. So it could be facial hair removal or body hair removal. Commonly, trans women approaches for facial hair removal and body hair removal also. And sometimes even trans men also come and they want to have hair growth on certain body areas, and certain body areas they want smoothening. So that is also there. So, but most commonly trans woman approaches for hair removal more. And here the best option available is a laser hair reduction. Here again, I have written reduction because laser treatment, that is a diode or long pulse NDR laser treatment that we give, it targets the melanin in the hair follicle, and that is how it is done in session. And it actually reduces the hair growth there. So what actually the diode laser is doing there, it targets the hair follicle papilla, the melanin pigment there, and it destroys it. And slowly the terminal hair formation is reduced and it becomes a vellus hair. So there comes a point after particular session of laser that your terminal hair, which was growing thicker, darker, and coarse, is no more there, and it has become vellus hair. So that is how the laser hair reduction is done. What happens in trans women? They are on estrogen treatment and they are suppressing their androgen also. So the beard and the mustache area is again a very difficult to treat area, especially the area on the submandibular area. This area is very difficult to treat even in cisgender females. So what happens here is it is resistant to whatever dose of laser sessions we give. So here we have to sit and tell them that how is the growth, how many sessions are needed, how are they going to respond to it. Along with that, are they continuing with their HRT? And very importantly is the cost, because laser session minimum 4 to 6 sessions they have to do. And the frequency of these sessions is every 3 to 6 weeks. So it is 21 days to 40 days is the interval. And that interval, when they start a session today, maybe I would see the desirable effect only after third or fourth session. So they have to be compliant while doing the treatment, because all of a sudden when the sessions are started and abruptly they are stopping, then after 6 months gap they are coming and then starting the treatment. So the results won't be as desired. So we have to sit with them and understand and make them understand that this is how the sessions will go, and for 6 months this is how you have to plan, and this is how the cost and everything will be. So all this has to be discussed prior, and above all we have to understand what is their realistic expectation, how much are they expecting, and how much they are going to be compliant with. That is very important here whenever a cosmetology treatment is given, because we know the mental health is very, very important when we deal with trans people. So we have to understand, are they mentally sound enough? Are they very receptive to the treatment? Are they understanding what we are offering them? Next treatment that is done for facial hair removal particularly is electrolysis. So here what they do, they use an electrode and the individual hair follicular area is being destroyed. It is little painful, and they say it is a permanent hair removal because you are destroying the hair follicle on that area. But post procedure folliculitis is very common, for which again antibiotics and painkillers, lot of things are needed. That is also done in session. So for electrolysis to work, it takes almost 1 to 1.5 years. So if you are starting a good high-end diode machine laser treatment for the hair removal, your results will be within 6 months. But if you are starting with electrolysis, it is a permanent reduction, but it takes 1 to 1.5 years for the permanent hair removal to happen. And then post procedure management has to be done effectively. Also, I was telling that they come for body hair removal as well. So for removal of the beard hair and mustache hair, as well as hair removal on the chest, trunk, axilla, hands and legs. The whole body hair removal also is desired by trans community. And along with this cosmetology procedure, we can also give them topical hair reduction creams, which is an agent that is ornithine carboxylase blocker, which blocks this particular enzyme in the hair follicle, and slowly the terminal hair growth, the color and the coarseness of the hair reduces. It actually, there are no evidence to say that how effective it is, but it is combined with the laser treatment procedure that is done for the hair removal. Again, very important is, it is not just that you are doing laser for your hair removal. Again, the post procedure instructions are very, very essential for them, that they cannot have any other procedure done on their face 7 days prior and 7 days after the laser procedure. They have to follow strict sun protection. They have to use sunscreen proper. Some people, after getting exposure to the laser light, they respond in a different way. Their skin pattern responds in a different way. They tend to have flare up of pimples, or they get pustules and folliculitis. Some people get edema, redness. So these things are there, and they last for a maximum of 5 to 7 days, and it goes off. So post procedure care is also very important, what thing to do, what not to do. And again, not to get panic if at all you get some redness or swelling or some flare up of acne, because laser light, when it gets into your skin or body, it has its own mechanism to work, and out of that some of the side effects are well known. So when a person is going for this procedure, obviously all these things have to be understood well, conveyed well, and then with consent, with a proper informed written consent, they have to go ahead with the procedure. Next is hyperpigmentation, which is, again, I was just mentioning, which is commonest treatment sought in cosmetology also. And the same time, tattoo removal. Tattoo, we know that it sometimes indicates certain belief or certain personal information about the person. So when a trans person wants to transform in the desired gender, they want to remove certain tattoos, or they want to change it to something else. So that is also one sought cosmetology treatment. What options are there when we deal with hyperpigmentation? So the conditions like melasma, I just mentioned, the pigmentation on the face, post-acne pigmentation, again, that is we called as post-inflammatory hyperpigmentation, dark circles, freckles, lentitions, to get the facial glow, to remove the tan, and again, as I said, to remove the tattoo. For tattoo removal, basically we have only laser option available, that is Q-switch Nd:YAG laser. But for the other pigmentation, along with the oral and topical creams, we can also give options of chemical peeling, which is very safe and very effective treatment. Next is microdermabrasion. So what is chemical peel? It is the control burns that are created on the desired area, which induces certain change onto the skin. The skin is exfoliated early, and that is why the new skin that comes from the stratum basale up, that is out of pigmentation. But this is a slow process. So when first session of the peel is done, again there is a gap between the next session. So 2 to 3 weeks gap is kept, and repeatedly when the chemical peel is being done along with your topical medication, it gives better result. So chemical peel, again, there are variety of peels available, from salicylic acid, mandelic acid, glycolic acid, azelaic acid. So alpha peels, beta peels, resorcinol, Jessner's peels. So they are stronger strength, they are moderate strength, and mild peels. So depending upon the depth and severity of the condition and what peel is going to help them, what type of skin they have. Is it a dry skin? Is it a very oily skin? Or is it a combination type of skin? All this we have to consider while planning a peel session. Again, as I mentioned, the post-peel consequences have to be understood. Any procedure, if you are doing, you have to have sun protection. You have to take care of your skin properly for first 7 days. And again, any parlor procedures or anything that has to be avoided. Microdermabrasion, it is again a dermoabrasion which is done with the help of a machine. and it is causing small abrasions on the surface of the skin, by which the pigmentation is being removed. It is also done in sessions. So all cosmetic procedures, we cannot say that one session you did and everything is just getting into normal. It takes time. So once you start, you have to wait minimum of 3 months for getting some change onto your skin. And if you are doing it very abruptly and fast and you want everything in a very instantly, that is not possible. What will happen because of that is they can have burns, they can have permanent skin damage, and that is alarming. Some people, they come and say, Ki, I have only 1 month, and within 1 month time I have to change everything and you just make me this way. But that's not possible, and this is very common demand that they come and tell us. So we have to sit and tell them that this is how it should go, and this much time you have to spend for that particular procedure. Tattoo removal, again, sometimes tattoo removal takes a lot of time, because the pigment that they have tattooed, if it is black color tattoo, iron oxide pigment is very good to remove. But if they have red color, green color, or yellow color pigment, these are nylon colors. So these colors are very difficult to remove. And again, area wise also, if they have done tattoo on the upper body, the results are better. When they have done it lower body, the results take little more time. So depending upon that, they have to understand what procedure they want to go through. So that is very important. The next very buzzy thing now in cosmetology is skin whitening treatment. And yes, trans community people, they always come and ask for it. Otherwise also, being a psychodermatologist, I would say that when a person says to me that I want skin whitening, the first and foremost thing that clicks in my mind is the person physically and mentally sound enough? Why do they want the skin whitening? Because if you are not happy with the color you are born, if you are not happy with the color your skin is right now, that is a lot of psychological distress. Sometimes it is out of proportion to what is really present. So that has to be identified first when we are doing a skin whitening treatment. Glutathione treatment is done in and out now everywhere, but you have to understand there is no evidence. It is not FDA approved medication now, especially the injections. Oral medications and topical medications works better, but injectables, again, when they are given, it has to be done with proper monitoring and proper systemic care that has to be given. So all these things in a setup where they are going for the treatment, they have to see that is all the things available here and how it is being given, because it is not just like any other injection that you inject and they can just go away, because it is given a slow IV injection along with high dose of glutathione and high dose of vitamin C that has to be monitored properly, and everything is to be recorded well. And above all, when the glutathione injections are started also, they start getting the effect. Sometimes it is just a glow. Sometimes they feel good about it, that the skin is glowing and they are seeing some change. But maybe after 5 or 6 sessions, also they are not having expected glow or expected whitening. So at that very time, we have to stop the treatment there and understand, is the expectation realistic or not? If we are dealing with an unrealistic expectation, it is better to discontinue that treatment, because it is not going to give any effect. Many of the time, glutathione injection can only bring that fine glow and flawless appearance. It cannot change the tone and the texture and the basic color of your skin. So that has to be understood well. Another thing in glutathione treatment, cost is the prime concern, because every injection, every session, every 2 weeks when you are doing, the cost factor is very important. So how many sessions you are planning, that has to be understood and offered better. And the person who is taking the treatment also has to understand. Next is topical depigmenting agents. Here I would like to mention that actually our association, the Indian Association of Dermatology, IADVL, we have a campaign against the use of topical steroid for skin whitening. This is also a very common problem that we see in trans community, that somebody has used a triple combination cream which has a steroid, retinoid and hydroquinone, and their skin became fairer. So their peer group, their friends, and everybody from the community start using the same. And when they come to a dermatologist, actually they have a lot of complications because of the topical steroid. So this is an alarming thing here, that any topical depigmenting agent that is being used on the face especially should be monitored for content of steroid and hydroquinone, because after you are using it, definitely you will have a fair skin, but there are a lot of side effects and a lot of irreversible changes that are happening onto the skin. Next, topical depigmenting agents which are safer are vitamin C and arbutin, which are natural depigmenting agents. Topical formulations are available which can be given. Then we have certain component of peeling agents which are available as depigmenting agents, like salicylic acid, mandelic acid, azelaic acid, and glycolic acids. So these are the topical options that are available to treat hyperpigmentation. Next very important cosmetology concern is scar removal and scar remodeling. Here, when I say scar, it could be acne scar, it could be any scar which was there in the past, accidental scar or surgical scar. Surgical scar, especially after mastectomy is done. On the chest, when the scar is lying, it is difficult for a trans man to be open shirt. So they always feel little awkward because the scar is lying there. So they come to us for how can they deal with that scar. Sometimes after the mastectomy is done, there could be keloid formation or hypertrophic scar formation. So treating that scar is very important. So what all options we have for treating the scar? We have derma roller microneedling, we have mesotherapy microneedling, we have lasers, and we have surgical procedures that we call as subcision or punch excision. So all these treatments again are to be done in sessions, and the minimum of 3 to 4 sessions are needed, but for the better results 6 to 8 sessions are advisable. Again, whatever options they are choosing, there are always pros and cons related to it, but any procedure they follow, post procedure instructions are must, and they cannot just avoid it. Another very common indication that trans people come to us for facial skin contouring, skin tightening, and rejuvenation. So here for that we can use derma roller, mesotherapy, or laser microneedling. Here we use non-ablative radiofrequency. Usually radiofrequency in dermatology we use for ablation, for removal of any skin tags or any lesions that are on the surface. We can just cut it, coagulate, and remove it. Here it is a laser microneedling where the radio frequency, which is non-ablative, it is used to cause certain change in the skin, like skin tightening, collagen remodeling, and rejuvenation. So this is also a short treatment for contouring, rejuvenation, and texture change on the face or any body areas. Then micropigmentation. It is a cosmetic procedure which is actually done on the scalp. And what do we do here is we create micropigments. We inject it in the dermis with the use of an instrument, which could be a mesopen, or there is special micropigmentation kit. We have to introduce that pigment into the dermal skin, and it gives a dotted appearance. That dotted appearance looks like you have a lot of hair follicles on that area. So it is a short treatment in both trans men and women who have scalp thinning or who have hair loss issues. What actually it does, wherever you have thinning or wherever you have lost hair, these dots are actually giving an illusion of having a good density on that area. So some people use powder, the hair volumizing powder and all. So that goes away after some time if water is happening or they are sweating. So with watering and sweating, that powder sometimes goes away, but this remains. So this is also one of the common treatment they come up with, that to increase the volume and make it little more dense. So scalp micropigmentation is this procedure, as you can see in the picture. Here he has a thinning and baldness, but the micropigments are created so well that it seems that he has hair all over the scalp. Here he has got thinning, and then micropigmentation is done. So it looks like he has good density of hair on that area. So in both the cases, even in male, trans men and trans women, this procedure can be done. What is the idea behind? This pigment, when it is going into the dermis, the macrophages into the dermis engulf it and it stays there. So the pigment stays there for almost 5 to 6 years, and that is how after 6 years again they have to redo. In scalp micropigmentation, again, there are touch-ups. So once the pigmentation is being done, first session, after 3 weeks or 4 weeks, they have to come again and we have to look for the area, how it has taken up the pigment. If somewhere the pigment has faded because of on the scalp, you will have sun exposure, and sometimes when you're washing also, if you're using any exfoliating agent or depigmenting agent, that will get removed. So that faded area, again, you have to do the touch-ups. So that is scalp micropigmentation. Next is microblading. This is very common in cisgender females also. They come for shaping their eyebrows or increasing the density on their eyebrows. Here again, the mechanism is the same, that we are injecting a pigment in a blading form. There are special blades for microblading. In a blading form, we are giving strokes and creating those eyebrows with that color. And you can see in this picture, here there is a thinning, there is a visible thinning. These are how the strokes are created. The approximation is being planned, the shape, size, density, everything we have to discuss and plan. And that is how the strokes are given and the eyebrows are created. So you see the first picture and the last picture, the density has definitely improved, the shape has changed. Here also you could see she had a very thin eyebrow, and now you could see that the eyebrow strokes are given and the eyebrow have become thicker and more nice shape as they want. So here the curve was different. Now here the angulated eyebrows are created. So this is also a short treatment in trans women to have beautiful contouring and eyebrow shaping. Next is body shaping and contouring. Both trans men and trans women wants to have a particular facial character, as well as they want particular body features also. So here for the face, we use Botox, that is botulinum toxin injections. We use hyaluronic acid fillers, threads, and even fat transfer to create that facial feature of the desired gender. Also, we can remove the under eye bags if they are there. We can improve the smile. We can improve the perinasal area. We can change the shape and contour of the body also by injecting these fillers and Botox in certain body areas. So these are the indications where all we can use Botox and fillers, like forehead lines, crow's feet, glabellar lines, bunny lines, laugh lines, cheek volume, under eye tear trough. So all your facial features can be improved by injecting this neurotoxin and hyaluronic acid fillers. Threads are again a new entity where you can get the results instantly. Botox and hyaluronic acid takes little time for the results, but again, these results are lasting for 6 months. You have to redo it. Next, coming to the dermatological procedure and hair transplantation. Hair issues are very common in trans people because they are on hormonal replacement therapy. So very commonly, the hair transplantation sought by trans men. That is what I see in my practice, because whenever they are taking the testosterone also, maybe other features can change, but to get the good beard and good mustache density is very difficult. So that is where I see a lot of trans men coming for beard and mustache hair transplant, while trans women, they seek scalp hair transplantation. Why so? As I mentioned, when they have already got a little hairline recession or genetic predisposition for the pattern baldness, they tend to have a little bald area or thin out scalp in a patterned way. That is what we call androgenetic alopecia. So in that transition phase from male to female, they want a scalp full of hair. So they come for the hair transplant surgery. Sometimes they may not have any baldness, but they want a particular type of hairline creation, which is more of a feminine, and the desire to have that type of hairline. So there also we can create a particular feminine hairline for them in trans women. Here, trans women, actually they take anti-androgen medication. They are on the hormonal therapy. They take estrogen. Here for the baldness, if we are giving finasteride, that also works better to inhibit the testosterone receptor activity on the scalp. Then I was mentioning the trans men who are seeking beard and mustache hair transplant. They are also, after the hormonal therapy, the growth will come, but it will be very scarce and very uneven. So at that time, they come for increasing the density, or sometimes they want particular shape or particular density in a desired way. So in both these conditions, trans women and trans men come for the hair transplant surgery. And for hair transplantation, there are a variety of surgical techniques available. Follicular unit extraction is the commonest one that we do. In that also, we have direct hair implantation. We have normal slit technique method. We have needle technique method. We have biostimulated FUU. We have stem cells. So there are a variety of things that are available. So when such treatment are being planned for them, again, as I mentioned, their overall assessment has to be done, how they are going to go ahead with, are they on hormonal replacement therapy, are they going to do any other top or bottom surgeries. All these things have to be planned and decided proper. So this is a picture of a trans man who had little growth of a beard and mustache, very little fine growth. So after transplantation, that is how the appearance changes. This is a trans woman who has grade 2, going to be grade 3 androgenetic alopecia, and she wanted a very feminine hairline. So this is how it is created. So you can see how the hair transplant make a difference in both of them. Next common treatment they see for hair fall issues is platelet-rich plasma therapy or mesotherapy. What is the difference? In platelet-rich plasma therapy, it is actually the platelet-derived growth factors that are playing role for the hair growth. And in mesotherapy, these are the synthetic growth factors or certain vitamins and herbs that are being injected onto the scalp, and that is how the hair growth happens. And this treatment is sought by both trans men and trans women. Particularly, they come for hair fall and hair thinning issues, wherein PRP is helpful. We can combine both the treatment. We can give few sessions of PRP, alternating with mesotherapy, and we can give treatment. Also, both this treatment can be done for facial rejuvenation and glow. These are injected onto your face or certain body areas wherever you want to change the contour or you want to rejuvenate. So platelet therapy, platelet-rich plasma therapy, and mesotherapy are both indicated for skin and scalp hair. And both this treatment can also be combined with hair transplantation, before a hair transplantation or after hair transplantation, as an adjuvant treatment. And these options are, there are a lot of options available for the treatment. So at what stage they are coming to us, what stage of baldness or what stage of hair fall, and how is the thinning, depending upon that, we can offer them whether they should go for a hair transplantation or mesotherapy or plasma therapy is enough for them. So this is again, there are options, and that has to be explained well. The person who is undergoing the treatment should understand the option better, because it is sometimes very early grade of baldness and still they want hair transplant, but that could be taken care by medication like minoxidil is the commonest medication that we give for hair fall, that can be taken care by that, or oral finasteride can help them. So all these options have to be shared with them, and then they have to involve in the decision making, because many a times we find that misguidance happens, and just because somebody has done hair transplant, they say that okay, I also want to do this, but it is not so. There has to be an individual approach in every trans person we are treating. So which is working for the other person may not work for him or her, and which is working for them may not work for the other person. So these options are to be sought in that way only. And here again, very important is we have to give informed written consent explaining pre, post, and long-term consequences of the procedure, so that there is no doubt regarding the procedure and post-procedure care. Next common dermatosurgical procedure, it is liposuction and lipofilling. So in some areas you have to remove the fat, and in some areas you have to fill the fat. This is done under general anesthesia, and actually plastic surgeons usually do it, but lipofilling, yes, a lot of dermatologists are doing it now. This is done for both trans men and women for body contouring and shaping. So in trans women, they want, because when they are transforming from man to a woman, they want their broad chest to get slimmed down. They want their abdominal fat to be removed, and they want to have a little more of a broad waist area. So that is the requirement. This reverse is there in a trans man. So trans men wants breast augmentation. They want pelvic contouring from slim to the broad one. And if at all they have cellulite or thigh fat deposits, they want to remove that. Even abdominal fat reduction is also needed in them. So these are the indications for liposuction and lipofilling. Also, some common procedures like creating a mole on certain body areas, creating a dimple on the face, or correcting the nose. These are common demands from the trans community people. So dimple creation, again, because it looks very nice when they smile, it creates, enhances their beauty. That is a concept they have. So they come for dimple creation. Nose reshaping, again, it's very common. Usually the surgical part is done by plastic surgeons, but when the nose reshaping is done with the help of fillers and threads, it can be done by dermatosurgeons or cosmetologists. So you can see in this picture how trans woman face is being transformed. So you can see the facial contour has changed, how the forehead has changed, the nose shape has changed, the eyebrow curvature has changed, the jawline has changed, lip broadening has been done. So how the pre-picture is, the post-picture definitely will give you more appealing look of a womanhood. So that is what they want, and they come and they ask us that I want this, I want that. Above all, you can offer everything, but you have to make it in a realistic way, because not always that everything is possible in a face, because sometimes if you do overdo, that again looks bad. So that has to be conveyed properly before doing this procedure. Then this is body contouring in trans men when they have done the mastectomy. This scar reduction they come with, they don't want it anymore. So that has to be treated with laser or topical things. And definitely when a trans man wants to be, a man wants to transform into a woman, they want their body contouring and their waistline, their pelvic appearance to change in a particular way. And that is also localized area contouring they ask for. Next, very common and very much stigmatized area that is there for transgender people is STDs and venereological issues. So when a transgender person comes to a dermatologist, or in particular a venereologist, because dermatologists are the only people who can deal with venereological disease, and they are the trained people who deal with venereology and leprology. So when a trans person comes to a venereologist, there are few things that we have to keep in mind. That we know that they are stigmatized, we know they are being marginalized for particular issues, and when they come with a complaint, we have to respect their privacy. And whatever sexual history or whatever information that we are getting from them, it's very confidential, and we always have to behave very friendly in a polite way with them. And non-judgmental attitude is very important, because many a times trans people, they come and say that because a particular doctor treated them badly, they don't see a STI clinic, or they don't go and seek treatment for their private area issues. So the person who is giving care to transgender in a venereology setup, they have to be non-judgmental. That is a very prime thing. And the questions that you are asking to them has to be very simple, direct questions, and non-personal question, because you cannot judge them and pass a comment on them that you people are like that, or you people are like this. This is something which makes them feel very offended, and that is where they become reluctant to come for the treatment, and that is when the non-compliance happens, and they sometimes carry the infection the same way and spread it. And here again, before you examine the trans person, before you ask them to undress and examine their private area, you have to have a attendant with you. You can ask permission from the trans person that what gender person they are comfortable with for examination. That is very mandatory now. Verbal, written, informed consent has to be taken from them before doing any testing or before doing any examination in their private area. So this care has to be taken by a dermatologist, venereologist, whoever is going to approach sexually transmitted infection or suspicious of sexually transmitted disease or infection in a transgender. So these are list of STDs and STI that are there. So actually this trans community is at high risk of acquiring STDs and STI. So what is the difference of STD and STI? Sexually transmitted disease are the diseases which are seen as signs and symptoms and they are treated. STIs, sexually transmitted infections, may not always be symptomatic, but the person carries it. So STDs are obvious, but STIs can be a symptomatic carrier. So that is a difference between the two. So any of the two, when they come, we have bacterial etiology, viral etiology, fungal and parasitic. So all these things the trans community people are prone for. So in venereology, we see viral infections commonly when it is an abuse, like we see viral warts on the genital area. Even herpes infection, genital herpes is very common. Syphilis again is not uncommon. Now syphilis and gonorrhea is also very highly prevalent. Candidal infections are very, very common in trans population. Candidal intertrigo, also dermatophytosis also. And genital scabies. If the person, the trans person is not having good self-care, self-hygiene is not there, genital scabies is also very common. So these infections are there. And why trans community people are prevalent for STDs and STIs? So these are certain reasons. First, I just mentioned they are stigmatized for carrying and transmitting the infections. And unfortunately, majority of the STIs are asymptomatic. So they never know that they have got the infections, and when they are involving into unprotected sexual activity, they keep transmitting it. They are ignorant and they are not aware about these infections. So they don't seek treatment, or they are reluctant to seek treatment for obvious reasons that if whoever they are seeing or whatever clinic they are visiting, if the doctor is not trans friendly, how the treatment will be given to him, how they will be entertained, or how they will be explained about the things. So they are very skeptical about it. So they do not go to any medical center. That is one thing. And when they have multiple partners, especially in commercial sex workers, when they have multiple partners, it is very difficult to trace the primary source of infection, because they do not know how they acquire, when they acquire, and who is the primary contact. Also, we do not have queer friendly or LGBTQ IQ friendly healthcare services available. So many a times when they are going in the medical OPD, or when they are going for any treatment, they feel that they are being mocked at, or they are being stigmatized, so they avoid visiting the clinics. And if at all they go and take treatment, sometimes to avoid that shame and fear, what they do, they go to quacks and take treatment. So the treatment is being taken, but it is very substandard, and that is why their infection doesn't go off, and then they keep transmitting it again. And if they are getting treatment proper also, they tend to be defaulter. They don't come for the follow-up, and there is a non-compliance. So the treatment is not being done in a proper way with the proper dose and medication. Again, the treatment fails, and that is how it is more prevalent in this population. What can be done? Definitely, early diagnosis and treatment is very, very crucial in any venereological disease. The early you diagnose, you can better treat it, and you can better avoid the complications. But here, especially, what is the problem? Here, the sexual behavior is the issue in trans population. If they are not aware about if the sexually transmitted infection, if they are not aware that how the safe sex practices are done, they keep on transmitting the infection. and oral and anal sex, or the people who are involved in commercial sex works, they are the people who have more chance of transmission and they carry the infection. So here again, the sexual behavior counseling is important. What is counseling? Counseling is educating them, making them aware about their own physiology, biology, and how the infections are coming and how they can prevent it. But counseling just doesn't stop there. It is also focusing upon the behavior change. So educating them and expecting the behavior change, that is what is done in sexual behavior counseling. So ideally, it has to have highly motivated person to go for the behavioral counseling. But then again, awareness is the key. And with that only some changes can be made. Here again, when the STI treatment is being done, tracing the primary contact, tracing the partner is important. Safe sex practices is important. Early diagnosis and treatment is important. Also, treating the partner is must, because that primary contact might be transmitting the infection to many others, and that is how it spreads on. And here the person who is giving the care to the trans community, they also have to have very empathic attitude towards them, or sympathetic attitude toward them, and non-judgmental behavior. Then only then rapport can be built and the behavioral counseling can work. Last but not the least, psychodermatological issues that transgender people face. So I think many of you, psychodermatology must be an unheard area, but it is a branch which is being functioning in Western countries since last 3 to 4 decades. But in India, we are now in a pioneering stage of having this branch of dermatology, which is little holistic way or a functional way of treating skin disease with their psychological issues also. So psychodermatology is a branch wherein we deal with dermatological issues associated with psychiatric problems, associated with psychological stress. It is like a two-way. Stress can cause skin problem aggravation, or if you have a psychiatric problem, your skin can manifest with something, or when you have a severe chronic skin problem, you will get stressed about it. So it's a two-way. And how skin and mind is connected, it is a very close connection, because they both are originated from the ectoderm. So from the embryo itself, that connection start. And skin is actually a part of NICE system, NICE. NICE is neurological, immunological, cutaneous, and endocrinological system. So all this manifestation can happen onto the skin. So what happens in trans population? So trans population, they have a lot of hormonal change, they have a lot of skin changes, they have a lot of immunological changes sometimes because of stress, their stigma and their bully or discrimination. This all comes together and they cause some stress-induced dermatitis, or sometimes when they have a dermatitis per se, they are more prone for getting into psychiatric comorbidities. So to elaborate in detail, we can divide the psychodermatological conditions in 3 categories. The first one is the primary skin disease, which is causing a psychological distress. The common diseases there are like psoriasis, vitiligo, hyperpigmentation, acne, urticaria. Here, there is a chronic skin problem which the person is coping and living with, and because of that, they feel negative body image issue, they feel socially withdrawn, they feel unwanted, unloved, because it is a visible and it is very disfiguring at times. Second is a psychological distress or a psychological comorbidity as a primary disorder, which will lead to a skin condition. Here, commonly we see disorders like trichotillomania, which is an impulse control disorder, because of which you see a patch of hair loss. You see body dysmorphophobia, which actually a dermatological non-disease where there is nothing on the skin, but the person is perceiving that he has a disfiguring body or disfiguring particular body part. Eating disorder again, like anorexia nervosa, bulimia nervosa, all this happens because of a psychological distress, and patient comes to us and say, I have this issue, that issue, my body part looks like this, I want to put a fat there. So there again, eating disorder is very common. Delusion of parasitosis. This is a proper psychotic condition where there is delusion of carrying the organisms onto their body, and they have all the time itching, scratching, and crawling sensation. Third category is stress factor, which is playing a role as an exacerbating or a trigger for the skin issue. Like, for example, acne, eczemas, psoriasis, telogen effluvium, that is a common hair fall, or melasma. In certain skin problems, whenever the stressful situation comes, the disease will get flare up or disease will exacerbate. So these are the three categories, and all these three categories we see in transgender population, because they actually go with the gender dysphoria many a times. And sometimes there is a self-doubt, sometimes there is a fear, there is anxiety, there is anger, a lot of those emotional issues they go through. And on top of it, when they get a skin problem, definitely the stress builds up, and they may go into anxiety disorder, they may go into panic attack, depression, and suicidal attempts also not uncommon. So that is why it is very important to understand the psyche and skin in transgender population whenever a dermatologist is dealing with their issues. So what are psychological issues this transgender people face when they have a skin problem? Stigma. Otherwise also they are being stigmatized for their gender. Other than that, when they get a skin problem, which is very much visible and which looks little awkward and weird, they feel that they should get isolated. They socially withdraw. That is internal stigma. Then there is an external stigma because people around them, they don't accept them, they don't accept their disease, and they don't mingle with them, or they don't get them involved in any activities which is done as a group. So stigma is a very very damaging problem that they have. Next is bully, abuse, and discrimination. That as a gender dysphoria, again, as a part of that, they face a lot of discrimination and abuse, anxiety, depression, adjustment disorders. Whenever a skin issue happens, when you have a itchy skin, or when you have oily skin, even when you have pimples on the face, you have to adjust with that facial image. Every time you look at the mirror and you feel, I'm not this person, my face has become this, my look has changed. Sometimes a lot of this preoccupation can give rise to delusional thoughts of having disfigurement and disability, or some functional disfigurement also. So that is what we call body dysmorphic disorder and eating disorder I just mentioned. So all these problems are very common in trans population who have skin issues and who have psychological issues also. So to conclude here, I would like to say that transgender skin care is not only limited to skin disease treatment or aesthetic procedure. It also have to involve their psycho-emotional component, their sexual health, and social health too. Having an inclusive attitude in healthcare service for them is need of the hour. So we all, the doctor community, have to come together and get rid of the transphobia. So more awareness generation is needed, and we have to demystify this gender concept. What is normal, abnormal? Because till now the medical books are mentioning that homosexuals are abnormal, their sexual behavior is abnormal. So that has to be demystified, what is normal and abnormal. And it is very essential that among caregivers, we should not have transphobia. If the transphobia exists, these people cannot come in inclusive healthcare services. So that is what I want to conclude here. And coming to our society, here I'm representing the Pride in Practice Society, which is formed 8 months back in Calicut, which is a group of doctors and participation from the community, trans community member also we have, and we are working together for the inclusive healthcare for LGBTIQA community. Other one is the Psychodermatology Association of India, wherein dermatology, psychiatry, and clinical psychology, we work together as a liaison services, and we deal with the dermatological, psychological, and psychiatric issues together. Coming to my team of Pride in Practice Society, we have founding people, Dr. Samira M. Jahagirtar. She's an anesthetist working in UK. She herself is a trans woman. Dr. Pratyusha M. She's a dermatologist from Calicut, Kerala Health Services. She's a founder president of PIPS. We have myself, I'm the vice president of the association. We have psychiatrist, Dr. Aishwarya. We have gynecologist, Dr. Shruti. We have pediatrician, Dr. Sheila. We have other cosmetologist, Dr. Anupama. We have a research wing community person, Dr. Situ Ponnu. We have an endocrinologist, medicine physician, Dr. Danish. We have a cosmetic gynecologist, reproductive cosmetic gynecologist, Dr. Lakshmi. We have our gender affirmative surgery expert, plastic surgeon, Dr. Meghna Bagalkot. So we have team of doctors from different fraternity expertise who are working for trans people in a very trans friendly and queer friendly way. And that is what PIPS is meant for. And we are looking forward for a lot of such association with doctors and NGOs for the better healthcare for this community people. In our association, we also have participation from two community members, that is Ms. Sanjana Chandran, she is a trans woman, and Mr. Hayan Ramesh is a trans man. So both of them are the activists and they are pursuing their career, and they are very well affiliated people into their area. And it is, they are included in the group with the doctors to understand their need so that they can come as a representation from the community and let us know what we can offer to them. So this is all about PIPS, and I end my talk here, thanking the organizers for giving me this opportunity. I think we can open the session for question answer.
Okay, madam, there are 2-3 questions that has come up. So the first question would be, what are the HIV-associated dermatology conditions and available treatments?
Okay. So HIV itself is a big topic. That is why I didn't mention. So when it comes to trans community and HIV infection, usually it goes to the medicine department. That's what we see. But when a herpes infection or human papilloma infection, that is genital wart or genital herpes, is coming to the venerology OPD, we also screen for HIV. Any fungal infection we see or any genital ulcer we see, we always screen for HIV. So when HIV is diagnosed, definitely there are steps to disclose and monitor and trace the contacts. Those all things are there, but as a part of treatment, antiretroviral therapy is to be started. And usually we refer them to USHAS, which is Kerala government organization. USHAS is the organization that we have in all the government setup. So Pulleri is the clinic for STD and USHAS is the clinic for the ART treatment. So that is how we refer it to them. And ART treatment is being given free of cost over there. So at least in USHAS, when the trans community people enter or any LGBTIQ people enter there, one thing is sure that they will not be stigmatized, because the people over USHAS clinic, they are all trans friendly. So that is one thing. And the course of ART is the same as it is in cisgender population. So there is no such change in the ART treatment, the tolerability, the complications, everything, it remains the same. So there is no particular guideline that this is a guideline for the trans community and this is a guideline for a cis community. There is nothing like that. And we yet to have such guidelines actually. So when a person is screened for HIV, definitely the counseling part, the initial steps are being taken, and when they have to put on ART medication, it is being done the similar way as it is done for the cisgender population.
The next question, ma'am, is like, what are the common post-procedural care, and share your inputs?
Okay. As I mentioned, any cosmetology procedure, if it is being planned, first, it depends that what type of skin they have, what is their demand, and how realistic is the expectation, what is the timeline that they have. These 4 factors are very important. And the 5th very important factor is the cost involved, because many of the cosmetic procedures are very costly. So this is first that we sit and discuss with the person, especially trans people. We always have to understand, because they are always lacking money and they have a lot of constraints related to that also. And above all, their mental fitness. Are they having realistic expectation? This has to be sought first. Next, post care. So if suppose I am giving a laser treatment, or I'm giving a chemical peel for acne or pigmentation, or I'm giving a treatment of Botox and fillers. So when the first group of cosmetology treatment, which is more of a pigment removal and acne and all that, they have to use sunscreen every day. So a good sunscreen, depending upon their skin type, is must. Moisturization of the skin is a must. If they are on the hormonal replacement therapy, they are going to have oily skin, so a good cleanser is very important for them. Depending upon the climatic situation also, that changes. And post laser, I was just mentioning, because post laser certain complications are known, like they will have redness, sometimes they will have swelling, little warm feeling on that area. They may have little pigmentation post laser. At times they have pustular lesions or folliculitis. So this on a written consent form, everything is mentioned before a person goes for the laser treatment, so that they have to understand. And certain post procedure medications are also there, like we give a mild steroid or an antibacterial cream to apply on the face to avoid the post procedure complication for 5 to 7 days. Sunscreen is mandatory. They are not allowed to use any irritants or soap or face wash for few days. Also, they cannot undergo any parlor procedure, or immediately they cannot just shave their face, or certain irritation, whatever can cause irritation on the face is to be avoided. So these things are mandatory that a person follows when they are on treatment. Sometimes even when the Botox and fillers are done, because we know it takes time for Botox and fillers to respond. Threads, as I mentioned, they respond very fast. Like instantly when you are injecting the thread in, you feel that the contour has changed and you get the visible result. But Botox and fillers, it takes little time. That is, we tentatively say 21 days, so 3 weeks. Because it has its own mechanism, sometimes when the nerve paralysis can also happen. So all the complications that are related to a particular procedure have to be explained well. And if at the receptive end, these post care and complications are understood better, then only a cosmetologist should go with the procedure. Because I see a lot of people that initially they are very excited that they want to get it done, but once they have little bit change than expected, then first of all, they are not going to continue with the treatment, and then they keep saying that this has happened as a side effect of the procedure. So that has to be cleared very well before starting the procedure. And any skin procedure that you do, it has to be done in session, and skin pattern of every individual person is different. So some X person has got redness, maybe the Y person will not have anything, or maybe the Y person will have a little bit of swelling only, and that will subside in hours. But the redness in the X person might subside within 7 to 10 days. So that differs, but both are normal. So that has to be understood first, because in trans people, they are so much eager and excited for the procedures and getting the expected results. Many of the time, these things are not being discussed with them. And that is why they land up in problems that they don't understand what to use, not to use, and how to care about it.
Okay, ma'am. The next question is like, what are the effects of puberty blockers and skincare requirements?
Yes. Again, here, when the puberty suppressants are given, we are actually going against the natural way. So there is some hormonal imbalance that happens in the body. So there is what I say, the acne that we see at a particular age after menarche, or in a male and female both after the puberty. Those changes will happen early, prematurely. Sometimes when the GnRH analogs are given, or even hormonal suppression therapy is given, at that time we see more of skin type change. Like till now, when the child was having a dry skin or normal skin, suddenly it becomes a very sensitive skin or oily skin. They start getting a lot of acne. Their texture on the skin changes. Sometimes even severe acne are seen. So very commonly, the hormonal change onto the surface of the skin is seen as change in the sebum secretion. So they get a lot of hair fall, sometimes pustular lesions on the scalp, abscess or furunculosis. So when the puberty suppression is being done, hormonal changes are happening. As a part of that, on the skin, sweat gland secretion changes will happen, oil gland secretion changes will happen. That is why they are more prone for oily skin, more prone for acne, more prone for bacterial infection on the skin, and they come recurrent actually. So till the time that hormonal imbalance is being regulated or corrected, these things keep coming up. So again, when they start on the treatment, this is also have to be educated to them that because of this can happen. Maybe parental education is mandatory at that time.
Ma'am, what procedures are needed prior to genital reconstruction and any insurance coverage for these procedures?
Insurance coverage is not there for genital procedures as such. But yes, there are a lot of NGOs and organizations which offer them at the low cost. And the procedure to be done before the gender affirming surgeries, cosmetologically, it's a plastic surgery basically. When gender affirming surgeries are done, it is a plastic surgery proper, which are done under general anesthesia and 6 to 8 hours of surgery. So definitely there is a pre-surgery, pre-gender affirming surgery. The person has to be mentally fit. First of all, mentally fit. He has to live in that desired gender for at least minimum of 1 to 2 years. And it is not necessary that he has to get a certificate, but we have to assess the psychology proper. And then we have to understand that whether he or she, the trans man or trans woman, is fit for undergoing the procedure, and what is the expectation again, and how much they want. Like sometimes there are a variety of surgeries that are available in trans men and trans women. Commonly the top surgeries are preferred because that is more appealing to them, that at least the look has changed. The genital surgeries are the next step. So, and again, the cost is involved. So minimum of 6 to 7 lakhs is the cost of the surgery. So that is not affordable all the time. But breast augmentation procedure or mastectomy, these are easier procedure. So if a trans man wants to transform, just a simple mastectomy can help them to get into that appearance of female, though bottom surgery is not done. Similar way in a trans woman, the breast augmentation simple procedure can help them to get into the contour of a female body. So those are the common surgeries done. Yes, again, pre-procedure, as the question was, the mental status has to be right. The patient has to be counseled till the day of surgery. The investigations are to be done proper. Ideally, before the surgery, for top surgeries, it is not needed, but for the bottom surgeries, since 1 year, they should be on hormonal replacement therapy. That is what ideally guidelines says. And dermatologically, there are not such guidelines as such to see whether they are on hormonal therapy or whether they are taking a surgery or not. Dermatology procedures that we do or cosmetology procedure that we do, they are equally same that we do for cisgender. Here, only thing that is very important is sometimes the expectations are too high than the cisgender population, because they are in the very dire urge to change and transform. So that is where a lot of mistakes happen, and that is where sometimes they want what procedure is to be done in 40 days interval. Sometimes they want it every 2 weeks. So you cause a lot of irreversible damage to the skin. That is the problem. Otherwise, I think top surgeries are safer and they are more appealing to them in their body contouring. Bottom surgeries, they have to undergo a proper screening, hormonal replacement, mental health assessment, and then again the cost factor, as I told, and then they can go for the procedure.
Okay, madam, there is another question. Madam, you mentioned about the laser microneedling. So
Yeah.
the question is, aren't they two different procedures, either laser or microneedling, with or without RF?
Laser microneedling is a different procedure. Microneedling, what is microneedling? These are needling with some microneedles. They are fine needles, and you are doing the needling to cause change into the collagen. Those needle goes deep down. So for microneedling, the size is from 0.5 millimeter up to 2 millimeters. So according to the area that we are treating, we can choose the depth. Okay. So when I say simple microneedling by derma roller, you all might have seen a derma roller is an instrument where you have a handle, you have the roller which keeps rolling on your skin, and it is a manual rolling. So you are just rolling that derma roller onto the skin, which is derma roller microneedling. Next was a meso microneedling, wherein it is a meso pen, which also has these microneedles attached and that you keep rolling on the surface. Then third one is the laser microneedling. So laser, we have a diode laser for hair removal, that is different. For scar removal, we have fractional CO2 laser, that is fractional CO2 is ablative. It actually causes charring and damage to the skin, and that is how the remodeling happens. But when it comes to radio frequency microneedling, here there is actually a probe wherein the needles are there, and with every passing needle, as it goes in, the radio frequency is being transmitted onto the skin. And that is how what we are manually doing by the roller or a meso roller, we are doing it with the laser machine. So the change that we want to have onto the skin, the target tissue is the same, just the energy or the mechanically what procedure we are doing is different. So microneedling is same. So microneedling can be done by derma roller, microneedling can be done by meso roller, microneedling can be done by laser RF radio frequency also.
So, madam, which one is actually the best? So, even if these three procedures are kind of similar.
If a person is photosensitive, need not go for laser because they may not tolerate. If a person has a pigmentation issue, again laser they don't tolerate, like photo tanning. That issue, pigmentation issue, they don't tolerate. So better options are the manual microneedling. But when they don't have any other problem, the effective treatment is a laser microneedling. In that also you have two lasers, that is carbon dioxide, fractional carbon dioxide, and you have RF microneedling. But as I mentioned, fractional carbon dioxide is little ablative, so it causes charring and pigmentation, and those laser dots will remain there for 5 to 6 days. But RF microneedling do not have that problem, so there is no downtime. Immediately next day you are fine and you can go and work and your face will be all right. But fractional carbon dioxide has this problem that pigmentation will remain and it gets exfoliated in due course of time in 5 to 6 days.
I think we have tackled all the questions. Samya, are there any other questions that I somehow missed?
No, I don't think we have covered all the questions. In case if Dr. Praveen, would you like to add any points or would you like to ask any question to the speaker?
Is there available or is there a connection issue?
Okay, so maybe I don't think. Okay, then Doctor, we can wind up today's session.
Thank you, madam, for the wonderful talk. As doctors, we all have an idea as to what might be some of the issues that the transgender people might be facing as far as skin and hair is concerned. But today, you really just took us into this journey of letting us know as to how much deeper all of these problems can go. Even psychosomatically, also, they can have a lot of issues. So that was such an eye opener because a lot of the times, like, we do not think in that way. So that was something really new. And you just made the topic very precise and concise. So that is also a very important part. That was a very important part of your talk. And I'm sure that everyone who joined in would have definitely learned something new from this talk. So once again, I really thank you, madam, for the talk and also for introducing us to the Pride in Practice Society and also all of your members who are actually taking such active participation to make the transgender journey and life very meaningful. So thank you in that aspect too. So before concluding, let me also thank everyone in IMA and IRA and also CARB who participated in the background to make this series a really huge hit. And last but not the least, at least let me thank Saumya for actually bringing all of us together, the speakers, the panelists, the delegates. So big thank you to you. Without you, I don't think this would have been as seamlessly as what we have seen so far in these series. So thank you so much for that. And so today, as we wind up, let me conclude by thanking all of the people who tuned in for all the web series. Sorry, for all the webinars. And thank you. Have a good night.